All right, I am happy to introduce our guest, Christine Compton. Christine Compton is a public health professional with a passion to improve outcomes and decrease disparities by creating progressive messages, programs, and policies to accomplish this goal. Christine is National Senior Advocacy Consultant for the American Heart Association's Voices for Healthy Kids team. She works with campaigns across the country, strategizing about policies that support the mission of the organization with a focus on equity and empowerment. And with that, I will turn it over to Christine.
Thank you, Raya. Good afternoon. Thanks for having me. It's great to be with you all. Today, we're going to spend a little bit of time together digging into a tool that can help us better defend and protect against harmful preemption. That, among other things, is eroding public health measures in your communities. Preemption is kind of a big word that you may or may not be familiar with, but basically it's when a higher form of government tries to limit, or in some cases expand, what a lower form of government can or can't do policy-wise. So for example, the Federal Minimum Wage Act is an example of preemption, but then there's also state restrictions that happened. We saw them a lot during the height of COVID, where local public health authority like vaccine and mask mandates were stopped at the state level. So Pathways of Influence is a part of the Power Prism tool, and it's a tool that we can dig into for research to influence key decision makers. So our objectives today are going to be a brief sampling of Pathways of Influence research and how it can help you build power for your initiative or your work, learning the steps for conducting Pathways of Influence research, and then trying it out with some online resources, and those links will be provided to you later. So just a little overview as we get into things. So what is the Pathways of Influence research? It's a systematic research of decision makers to find the intersection between their relationships and interest in your campaign assets to strategically apply pressure for your campaign. Next slide, please. So those intersections of your campaign assets and those decision maker relationships and interest are, that's where your power is. That's where you can really lean in and apply that pressure to those decision makers to help change how they're thinking or get them to support what you're trying to influence or change. So it's a multi-step research process. It was originally developed by Lori Frazina and Diane Pickles. And it was designed to uncover those key decision maker relationships and connection points. So you can begin to identify what they really care about, what decision makers find valuable to your campaign and what you find valuable, where those shared interests are, and then using this knowledge to create campaign strategies to strategically apply that pressure. So we start by asking 3 key questions. So one of the main things I do on the Voices for Healthy Kids team and at the American Heart Association is I coach policy campaigns. And we always start with these 3 key questions. It's tempting to jump right into the work of Pathways of Influence research, but winning policy change campaigns, these are what we know to start with that can really set us off on the right foot. So what do you want? What is the policy change that you are seeking to address with your issue? Why do you want it? What data makes the case for this policy change, and who has the power to give it to you? Which specific decision makers in state or local government have the power to make that change? The answer to these questions can change throughout a campaign, so it's helpful to get into the habit of revisiting them regularly. So for today's session, we'll specifically concentrate on who has the power to give you what you want. So why is Pathways of Influence research useful? It can really inform that campaign strategy, like I mentioned. It brings forward those powerful messengers, not just the messages, because who delivers that message to those key decision makers is really very valuable and can make or break your campaign sometimes. And then strategically helps you use resources and decision makers' time and attention, and can really help you neutralize opposition or build support for your campaign. So first, of course, we're going to determine who we're going to research. And then we're going to conduct that research on the decision maker. And those are the 2 steps that a lot of people usually do, right? So those are kind of easy. We're thinking about, okay, who do we need to influence? Let's look up just a few things about him or her, maybe ask a few folks. Maybe we think we know a lot of things about this particular elected official. Maybe he or she has held their seat in Congress for many years. So sometimes we might take those first 2 steps for granted. So this is a good exercise to help us think about digging a little deeper. So those other 3 steps of the main process are identifying those potential pathways of influence based on research and thinking about, what are the things that hold potential to influence the decision maker? So again, maybe not the likely things about where he or she normally votes on a particular issue, but where's their funding coming from? Are they influenced by people that they go to church with? Are they connected to, the business that they do outside of being a lawmaker? In most states and certainly in communities, people are not full-time lawmakers. So they have other interests that may sway them. And then step 4 is really figuring out where to overlay those campaign assets in order to find those points of connection. And then the last step there is, figuring out who are those campaign liaisons who could really influence and apply pressure. So one example I'll share with you here is several years ago, I was working on tobacco control issues in West Virginia. And we figured out we had a board member at the American Heart Association who went to church with the Speaker of the House. And the Speaker of the House, we knew he didn't like smoking, but that wasn't enough to keep him from holding the line on this particular policy that we were worried about. It was going to change. It had the potential to erase local smoke-free ordinances throughout the state. So we knew he cared about that, but we knew he didn't care enough about only that. But he did really care about gambling, and he didn't like that. And so once we figured that connection out, we were able to have Barbara, who was our board member, have conversations with him and eventually get several of his church members also to lean in, make calls to him, have conversations with him to talk about, how terrible, awful the gambling was, which really helped us get the smoking stuff to stay in place. So it was kind of an unlikely path, but we were fortunate enough because we didn't have a lot of resources at the time, and we were able to really lean into that particular connection point to help stop what we knew would be very harmful legislation for our state. So we'll come back to that example later. So, when we're thinking about the activity, and Raya is going to share this link with you all later and as follow-up, but we have a great worksheet that helps you walk through some of this activity. But of course, the first thing we need to think about, who is that decision maker that you want to research? So as we go through the rest of this time together this afternoon, maybe you all have an idea already in mind about somebody who's just, been particularly supportive on some of your issues, maybe particularly difficult, that you'd really like to figure out what motivates he or she so that you can either get them out of the way or get them on board. So start thinking about who those gatekeepers are. And then as we go along, we'll think about how to dig into that a little more deeply. So back to those key 3 questions. I need to not write that way. Anyway, 3 key questions. We always want to keep bringing it back to that as we think about what are the steps to do the pathways of influence research and to do some power mapping. What do you want? Why do you want it? And who has the power to give it to you? And these questions might change throughout your campaign, so it's important to revisit them. So that's why I'm revisiting it today in this presentation, not to be redundant, but so that we can remember that, sometimes those decision makers change, and sometimes the influences in their circles can change. So maybe they will move eventually, even if they don't initially. So who has the power to give it to you? That's what we're going to dig into today. So who holds those positions of power in the legislature or on certain committees? Has someone been recently appointed to as a new committee head? Were they recently elected or reelected? How long is their term? This is a good time of year if you want to get to know some of the newly elected folks. Sometimes we kind of take them for granted because we know that there's someone who's held a committee membership or a committee head for a long time, and we know he or she has a lot of power over that committee. But don't forget those newly elected folks, because sometimes they can really become a champion now when you have time to build a relationship with them, and then later on as they gain power or are trying to navigate what they're going to support or not support, it could be a great time to build those relationships with them. So again, think about how long their term is. Are they on their way out? If they're not newly elected, are they maybe on their way out? Have they publicly said this is their last term? Maybe you're in a state or community that has term limits. So those are things that also could be a motivating factor for how much or how little your decision maker engages on a particular issue. And who poses a challenge to your legislation? Again, we talked a little bit earlier about neutralizing opposition, trying to figure out, who is that group of people who might oppose the legislation. And if you can get them to stand down or to become neutral or to address their concerns, then maybe your decision maker will be more likely to get on board with your initiative. Who was an instigator of preemption policies? I think this is the only other time I use this word. But anyway, preemption policy is someone, in your community or in the legislature. Have they introduced a lot of this type of legislation that could be harmful to communities in the past? And then don't forget about your governor, your mayor, your city council members, maybe a lieutenant governor if you have one in your state. Those people can be influenced just as much as people in a legislature or city council can be. So again, finding those pressure points and then finding who has those connections to get to those people in all levels of government. So what can research uncover for us? So there's a whole bunch of stuff, right? If we really start to dig in. So, all these things are going to overlap a little bit and they're going to inform each other and they're just going to build kind of like layers of a Jenga tower or whatever. But so for each one, you want to consider, what are the challenges or oppositions that your decision maker might have. So looking at the first section there, the biographical information, what's their family situation like? Where was their childhood home? Did you happen to grow up in the same community? What school did they attend? What career do they have? Again, like I said, a lot of folks have careers outside of being lawmakers full time. So there's, a lot of times figuring out what they do for a living and where they work and who might know that or have a connection to that could be really important. Hobbies and interests. Faith community, I mentioned the example of my friend Barbara, our board member, and Speaker Armstead. That was a good one. And then looking at the political information, that stuff might seem a little more obvious, but maybe you dig into that a little bit more. There's a lot of news in the different sources these days about political ideology and where people are entrenched, but are there areas of commonality that you can dig into and find with that particular person? And then obviously we need to look at like donor information. Where is their funding coming from? Is that what motivates them? And we're going to dig into that a little bit more in just a moment. And then going a little bit deeper with connections. Again, what are those personal connections that you or some of your coalition members or colleagues might share that connect to the decision maker? And of course, looking at the legislative district and where those connection points are as well. So don't forget those. And the other thing to consider, when you're looking at political information is what is the decision maker's political ambitions? Has he or she made that known? Do they intend to run for a higher office? Is the person going to run for governor? Do they want to, try for a seat in Congress versus a state seat? Are they going to run for like an attorney general position or ag commissioner or something? So think if you can uncover where they think they're going next, that can be a good pressure point as well. And then don't forget the importance of people like their chief of staff, their support staff. A lot of times those folks can be gatekeepers and can make or break the difference of you getting a meeting with your decision maker and in getting messages to them if you're really trying to reach them at a critical point in the legislative process and you're having trouble. The staff can really make a difference of whether or not you can reach that decision maker or not. So, so what can the research cover or uncover? So again, political ideology and issue focus, legislative districts and priorities, possible potential opposition, campaign donors who might oppose the issue, business connections that could pose opposition, and then those personal connections and what is that circle like? So a lot of our campaigns at the American Heart Association, we've been dealing with opposition for a long time, so it's not new to us. I think most of us in public health, the joke I always said when I was working on my master's degree was that I'll probably never work myself out of a job working in public health in a state like West Virginia. But, a lot of issues to overcome. So, we've had some entrenched opposition, which are the likely ones like big tobacco or big soda or big pharma, big food, but sometimes there's additional connections that and influencers that can cause opposition and roadblocks to what you're doing. And then what are those specific challenges for a decision maker depending on their personal connections? It can be helpful to understand those as well. So you can obviously find a lot of this information by doing some digging. So the obvious ones, right, are the ones we're all familiar with: Facebook, Twitter, Google. Even the Federal Election Commission has reports that you could dig up. And of course, campaign finance reports, which we're going to talk a little bit about next. But public resources for research. Next slide, Ryan, thanks. So again, we've got Google News, social media, decision makers' official website. A lot of stuff's on there, but of course they're going to put what he or she wants you to see as that forward-facing information. The campaign website, if there's a certain platform or certain issues that he or she promoted during their campaign, that's where you're going to find that stuff, of course. Press releases, what is the media covered about the particular decision makers? Legislative websites for bill sponsorships, you could dig into those and see the types of issues that he or she has supported in the past, what they've co-sponsored or led on, and again, those public finance reports. And after you do that, then you can go even a little deeper. So once you've started this research, you can also start to dig in by, putting in specific keywords into that Google search. So for example, say you're working on a healthy kids meal campaign at the American Heart Association. So you might put in the search, the decision maker's name, sugary drinks, and then restaurant association. So we know if they're getting money from the restaurant association or from Coca-Cola, for example, then maybe they're probably not going to support our issue. And then there's the ones that aren't maybe quite as obvious when we're looking at where those connections come from. So if we're pulling up things like the Restaurant Association, big cola, big pharma, big food, big tobacco, those are obvious connections. But what about when we go to dig in and look at how to neutralize the opposition? Sometimes we can assume, because it's a public health measure, that the hospital association, certain medical groups, medical facilities, or even a university is going to be supportive of our work. But once you do a little bit of digging, and sometimes it doesn't even take much digging, you can tend to find out. For example, when I was working on sugary drink tax work in West Virginia, I really needed West Virginia University to support that. And they have a great public health program, but they also take a whole lot of money from Coca-Cola. So they were not as enthusiastic as I hoped they would be by understanding the impact that could have been made from passing a sugary drink tax, considering the high rates of diabetes and obesity in West Virginia. But they do take that money from Coca-Cola. So again, that became a sticking point. So those are examples of that. And then we can go even deeper. If you go to advanced searches on Twitter and Facebook, so going into those three little dots in the upper right hand of those websites, and not only looking at what your particular lawmaker that you're researching tweets or puts out, because sometimes they have people doing that for them, right? So the higher up in government or their elected seat that they may fill or hold, they're probably having staff that are doing that for them. But also look at who's commenting on those posts and tweets, and considering what that specific issue is in your state, to see who's connected to that, who's commenting from your state, and who are they connected to. And again, this can help identify potential opposition. So let's look a little bit at campaign finance reports. This might be a little bit in the weeds, but you guys are public health folks and you like it in the weeds. So looking at campaign finance reports. So elected officials obviously have to report their campaign contributions. There's been some stuff in the news where people have fabricated those, but we're not talking about that example right now. We're going to talk about the ones that, typically are out there for public facing folks to look at. So itemized contributions are most helpful to identify those large donors, as well as individuals and organizations, the location of those donors. So do they have a tie to your community, or is it somebody from another state, or or territory that's not even, doesn't have a direct connection to your lawmaker? And who are those individuals or organizations that fundraise on behalf of a candidate? And then how deep you go really depends on the time and resources that you have. Obviously, most campaigns or most initiatives don't have a whole lot of time and resources, but you could find a lot of things by some Google searching and going to the right places. So federal donors may only, may only have some of their top donors listed, so you might have to do a little more digging. The same thing with local and state, especially if some of the smaller seats in government, they may be doing, fundraisers at people's homes and in the community. So those might be a little bit harder to find, but look at who their employers are or who the employers of the people who are the biggest givers are, because that can help you trace that little breadcrumb trail as well. And look for patterns that keep coming up over and over again. Look at PACs that might be donating to them, including the opposition that might be coming up. And also go the next step and look at the lobbying firms who represent them, because the lobbying firms might also represent some of those organizations like big beverage, big tobacco, so forth. So you gotta dig into that next layer too. So an example of where you can find some campaign finance reports, there's a site called followthemoney.org, and that one has aggregate reporting of campaign finance contributions at the state office level. They used to have federal reports as well, but they have merged with another organization. So now federal reports can be found on opensecrets.org. So again, those are for elected officials. The website note that I just looked at earlier for Follow the Money says that they are merging the National Institute on Money and Politics is joining forces with Responsive Politics, and they are creating Open Secrets. So again, you can go to Open Secrets for those federal reports. But followthemoney.org has campaign financing reports for state level electeds. So this next screenshot is just an example of one of the reports that you can pull. This particular one was from a report from a Senator, John DeSanto in Pennsylvania. We just pulled this as an example. So you might have to comb through there a little bit to find contributor names and amounts over years, but it all depends on how much time you have and how curious you need to be. Sometimes it might be really interesting to kind of do some sleuthing to figure out where that money comes from and why they hold the positions that they hold and the voting pattern that they hold as well. So, and then another example of a campaign finance report, this one was from a state representative in Maryland, C.T. Wilson, and this was some aggregate data that we were able to pull as an example. So you can see some of the number of donors. The Maryland Association of Realtors gave 13 different donations, and they were the biggest donor. So you can see how that played out for that particular person. So then as we're kind of, after we went through some of our top tips for exercises and activities and how to dig in, remember that you can really inform your work by doing this type of exercise and research. You're going to expand your knowledge about your lawmakers and your community and how and why decisions are being made in your state and how they're being made in federal government level as well. You're going to really build that valuable support from grass tops and hopefully grassroots as well. And then you're going to create new contacts for your campaign and understand more about the opposition. And remember that even if you're not successful initially, again, you're going to be building these resources for your campaign and for the future work that you do. So each step you have to kind of reconsider. It's easy for those of us who've been doing this work for a long time to kind of take it for granted and maybe, like I said, only ask people or take what we see in the media or so forth about an elected official and assume we know his or her opinion on something already. But if you can take a little bit of time and do some further digging, you might be able to find some different information and get some different results. And again, it's really laying the groundwork for the future. It took me 9 years to pass a basic breastfeeding and public law in West Virginia, so don't get discouraged. It can happen eventually. But anyway, so that's the gist of what I had to share. And I think we have some questions and final thoughts, maybe.
Great. Thank you so much, Christine. Those are wonderful. Can you hear me? Okay, good. Zoom was not giving me the feedback that it usually does. Anyway, that was a really wonderful overview, and really glad that you were able to go through in detail all of those strategies. We're excited to be able to share a number of the different resources from Voices for Healthy Kids and from APHA as well, and we'll do that in just a moment. I wanted to turn to some questions that we have gotten from folks who submitted questions in advance of the webinar here. But as we go through and you reflect, please feel free to include questions in the chat, or once we get to that space, definitely feel free to ask those questions out loud as well. One of the first questions that we got was just about ways to gain interest from community partnerships. So I don't know, Christine, if you wanted to address that. Oh, Christine, I think you're reconnected to the wrong mic again. So sorry.
That one better?
Yes, thank you.
Okay. So weird. Anyway, sorry guys, was trying a new toy. Apparently don't know how to use it yet. Anyway, well, this may be more specific to just general campaign work in general, but as far as connecting with the community, you can really identify some of those unlikely allies by doing some of this power mapping research and figuring out what motivates that particular lawmaker, and maybe where those connection points might be. So for example, I'm going to draw on examples I have handy in my arsenal here. So the governor of West Virginia is a big high school basketball fan. He coaches girls high school basketball in a community where he's from. And so, knowing that that's a connection point, for example, that's his interest. So a couple of times folks were trying to get his attention and they had girls basketball players from around the state message him instead of just from that particular team that he coaches. Parents and coaches and different players from around the state had messaged him when the teachers unions were trying to get the pay increases. So that was a way that they applied pressure for something that he usually pays attention to because he interacts with these other sports teams across the state. So you can really kind of identify what those connection points are if you look at what is of interest to the decision maker you're trying to reach.
Great. And that actually opens it up to another question that we got. And you've touched on this already, but how do we really, mobilize the youth to get involved in this process and get involved in advocacy?
Well, again, trying to figure out what really matters to them. I certainly feel like we've heard a lot in the news lately that, Gen Z seems to really care about things like environmental issues and health concerns. And so finding ways to reach them and connect with them, which you can do from, figuring out maybe the lawmaker's son goes to school with your daughter, or they play on the same soccer team, or, one of your board members, goes to church with them, whatever those connection points are. But figuring out what their interests are and finding a way to connect with the youth is the same type of thing. The youth are also really great at things like technology and connecting with their peers, and they seem to be pretty interested in things like marches and protests and organizing those types of walk-ins or walkouts or what have you. So I think figuring out what the youth in your area care about, and if there's a connection point to that decision maker, and then finding ways to rope them in. I know we were trying to get some interest in some of the work we're doing here at the American Heart Association, and we did a series of ads on Snapchat, and we did a series that had the higher click-through rate than ads on Facebook did. When we were trying to reach two different demographics, but you need to go where they are. So go to those things like YouTube and TikTok and Snapchat, and then the old-fashioned things like the soccer field and the baseball field and the schools.
Great. And we're getting some examples in the chat as well of successful connections made over lunch meetings and that sort. One question that I'm seeing as well is it possible or where can we see individual persons that gave individual amounts to candidates or elected? Is that something you're familiar with?
I don't know for sure, but I know you can dig a little bit into that on those two sites that I mentioned, the followthemoney.org and the Open Secrets. I think it depends on how much an individual gave. So, if it's a lower amount, it's going to probably be harder to find. I don't know if someone else has specific information about that, but that's what I think.
Great. And then one other question that we got submitted as well was just about, strategies or ways that maybe even examples that to get policymakers to support public health and public health priorities when there's conflicting commercial or financial interests involved.
And that one's tricky. Like I explained, we just thought a likely ally was going to be West Virginia University because they have this great public health authority group and they have this, School of Public Health, and their leadership was very involved in a lot of other legislative priorities. But when we really did some digging, we found out, that they were just taking a whole lot of money from Coca-Cola. So that was going to be a problem. I think anytime you can make that connection financially, though, so not just considering how much money they're getting from maybe corporate America or whatever, but pointing out the how much money is going to be spent trying to deal with a public health issue if it isn't addressed by the lawmaker or by the particular piece of legislation. I think anytime you could make a financial claim and show, how much money is going to be saved or lost, I think that typically at least gets their attention. But it certainly is harder when there's a whole lot of money coming from outside organizations that we just can't compete with in public health.
Right. Thanks for tackling those. One quick administrative question before we open it up for other questions. Is it okay, Christine, if we share these slides after the presentation?
Of course.
Great. So yes, we will be sharing these slides as well as the resources that we've discussed today. I wanted to open it up to anybody in the audience who had questions. I'll give folks a moment to reflect on any questions. I know we've gotten great input in the chat as well, and feel free to, unmute and share your questions as they come up. But I wanted to highlight that Angie, my colleague, has put into the chat a number of the resources we discussed today and a number of other additional resources that will be useful when you're doing this public health advocacy. So one to highlight is our Public Health Authority Toolkit, which is a Google Doc link that Angie put in the chat, as well as the Voices for Healthy Kids Campaign Resource Library, which is a great resource of a number of wonderful tools, searchable by type of resource and by what your topic you're looking for. So definitely recommend checking that out as well. Great. Let me preview as well. This is the slide with our preview of our Public Health Authority Toolkit. Yeah, and so Christine, one other question too that we're seeing, if somebody is new to advocacy or new to engaging with elected officials, what's a good first step? What's something that they can start to do as they're getting started, as they're breaking into this space?
Well, really one of the first things you could do is some basic steps that we covered, the first couple steps in power mapping or pathways of influence, and figuring out who the decision makers are that might care about the particular policy or initiative that you want to work on or create a momentum movement for, and then figuring out how best to connect with them. I mean, is it convenient for you to make an appointment with he or she while they're at the State House, or after a city council meeting, or if you can go meet with them in their district, if they are a state or federal level official, that's always typically a good time if you can work that into your schedule and you can work it into their schedule. It's sometimes easier to connect with them if you meet with them in their district office. And again, really consider connecting with newly electeds, because they may have a little more time to talk to you and get to know you, and you could find those common interests. And then I'd also, again, encourage connecting with their staff, because they can be significant gatekeepers. So if you know, I know very few of us who get federal level appointments with anyone other than staff, but take those appointments because they're going to get that information to the decision maker. And if they like you and you build a rapport with them, then you're going to be able to ultimately get to that decision maker as you take the time to build those relationships.
Right. Those are great pointers. And one additional question in the chat. I wonder if you have examples, or if you have any tips about connecting with community colleges and or schools of public health more broadly in doing this advocacy work.
Well, I would say one of the things you might want to, obviously I would look at, do they have a school of public health? Have they engaged in any public support for a particular issue that you might care about? Do they have a connection to the legislature or the governor or city council in your community? Figure out maybe if anybody in the elected body went to school there, right? There's obviously alumni connection would be an easy place to start as far as that goes too. But, I would encourage building relationships, if you don't already have them, with some of the public health professors or the dean of the School of Public Health, and reaching out to them, and maybe anyone in their leadership. They're going to have attorneys, they're going to have lobbyists, and seeing if there's a connection there that you can make. But a lot of times your public health folks might be more open to making that connection or introduction for you, because they would hold that and maybe be willing to make those introductions for you because of your shared interest in public health or public health authority.
Great. Yeah. And I think even back to your earlier point too, there are, students and young people can be particularly connected. So, building and fostering those relationships for students in advocacy is a great way to do that. Yeah. So two fairly similar questions in the chat about approach to communicating with strong opponents, kind of, where you may not be aligned, or where they may just shut down a conversation initially because they believe that you have a certain set of beliefs, or when you're experiencing backlash. So any tips on kind of navigating those that can be kind of sticky situations?
They are sticky and they're not easy, so I'm not going to pretend like they are. Well, I think the first thing is really do your research and figure out, why they're opposed to your issue. It may be obvious, it may not be, and see if there's some areas of commonality that you can agree on. For example, I'm sure most of you are aware that recently Governor DeWine here in Ohio vetoed a terrible, awful tobacco preemption bill that would have not only stopped local authorities from regulating tobacco products in the state, but it would have repealed all the existing tobacco control laws in the state. So it was really awful. And, not only did the advocates realize that he cared about home rule, but he also cared about the concern of youth becoming addicted to tobacco and what that could, those implications it would have for their longevity and their health. So they were able to rely on both of those pressure points to get him to veto that bill. And so I say that because, finding those alternate points and those workarounds when it seems like that a particular decision maker is only going to do something because of the influence of their party, or because of finances, sometimes there is another way to come at it.
Great. Sorry, I think we had a little blip in the Wi-Fi there, so I jumped off for like 0.3 seconds, but I am back now. Hopefully you can still see the slides. And thanks for folks who have joined us and are headed off to other meetings. Yeah, I really appreciate that insight and kind of navigating that. I wonder if you have experienced at all in your, to an earlier question in the chat, if you've experienced legislators or decision makers saying like, oh, how did you how did you get that information, or being offended that you've done some digging? Is that a concern at all in this situation? And I see, Lindsay, you've raised your hand as well.
Well, I have not experienced that directly. I'm not necessarily suggesting that once you get this information, you go to said lawmaker and say, look what I found out about you. Probably not the best way to get a conversation going or to establish or build rapport. But doing that research helps you figure out who needs to go to talk to that lawmaker, because it may not be you. It may need to be someone who does not look like you or has a connection that's just completely different than yours. So I don't recommend necessarily sharing that. Now, if you go to church together, or Johnny and Susie play soccer together, then yes, maybe you want to start with that. But if it's something like, oh, I found out you're taking a whole bunch of money from Big Tobacco, probably not ideal to lead with. So again, I think you do that research and you think about what makes sense to build those connections from. But I have not experienced anything like that with particular backlash.
Great. Thanks for sharing that insight. And Lindsay, anything that we want to share from APHA resources?
No, well, yes, kind of. So for our affiliate folks, so those are our folks who are at our state public health associations, we do have monthly discussions that we're kind of hemming and hawing about what it's called, but really it's a discussion series about how to touch on tough topics with hostile audiences. Those are led in part by our immediate past president of APHA, Kay Bender, who is also the executive director of the Mississippi Public Health Association. Those are not recorded, so that is where you can speak freely about any of these conversations. We have them on the fourth Tuesday of the month at 4:00. The invite is always in the affiliate online community. It is available only to folks who are in their state public health association. But it is a really worthwhile conversation where folks are having these conversations about when they do face lawmakers or their own members or their community members who are not maybe on board with some of the public health work that they know needs to be done. How do they message around it? What has worked? What has not? It's really useful, and I would invite all of you to come out.
Great. Thank you so much, Lindsay. And just a quick plug too for our future sessions. We are going to have a session on communications that is going to be on February 8th. So continuing some similar conversations about public health advocacy and communications as well. But definitely check out those difficult conversations, and the invite is in the affiliate online community. There's a few additional questions in the chat too. So wondering about the federal perspective and preempting things coming in from the state that would impact the feds. What's their approach on combating that?
Yeah, I just read that, Raya. I don't know that I have an answer on that. If specifically the question is what are the feds going to do to combat that? I'm assuming there's going to be lawsuits filed as far as that goes, but yeah, I'm not sure what that path is. I'm not familiar enough with the legislation, but if the state government is basically trying to go around what the federal government has told it, then the only path I think there would be some kind of litigation.
Great. I don't know, Rebecca, if you wanted to expand on that at all.
Well, I was hoping you'd have a different answer.
Sorry.
No, I think it's just hard to know, like, how do you say, because the folks who are dropping a lot of that, and, you know, we have one that has a hearing next week in Arizona, and like, there's no point in talking to this bill sponsors or anything like that. And we don't expect that it'll get signed by our governor, but just what is, like, how, other than saying this will just result in litigation, I mean, what other talking points could we maybe give? And I just don't know if other people are coming in and informing them as well. I mean, they don't really care that it's going to result in costly litigation. Look what we're doing with reproductive justice. I mean,
right.
We're sued all the time. So I don't know if there's a different answer now. I don't know. It's not just our state. I know other people are doing.
I'm sure it's not. Yeah.
Like, other than saying you can't do that.
It is a great question. I just don't know what the answer is. I don't know.
If anybody's thought, and I
Yeah.
can, sign on to Kay's calls too. But if anybody has like talking points that you've tried, because I think we've all kind of tried them all and they're not working. But it's just preemption in a different way.
It is.
Yeah, this is Angie. I agree. I don't think we know what's going to happen. I'm guessing, like others suggested, there's probably going to be a fair amount of litigation. The federal government could try to tie funding to these types of laws,
Right.
saying this isn't a good strategy. We've said people need to get vaccinated. But unless a federal law passes, which probably is not happening at this point, I think you're right. I think it's going to be a lot of back and forth.
Wasn't that how
But-
seatbelt laws became widespread? The federal government tied it to highway funding, I believe. Is that correct? Again, you gotta follow the money trail. That might make people pay attention.
And there's some good suggestions in the chat, I would say, from other colleagues on how to message it. So maybe together we can figure out some ideas.
Yes.
For seatbelts, incidentally, one of the tactics was to get to insurers and convince them that if they didn't pressure the industry to put in seatbelts, that they were going to be the ones that ultimately paid the price.
There you go. Yep.
You know what? I wonder, I don't know if we're talking with our medical liability insurers.
Yeah,
That's helpful in the
that's good.
past. Yeah, that's a
yeah,
great.
that's a great
idea.
point. Try that. See where they stand on it. See if they'll support your stance on that.
Great. This has been great discussion, and I'm glad we've been able to brainstorm a little bit too here on potential strategies and messaging. Any last questions before we wrap it up today? Thank you all so much for joining us, and thank you so much, Christine, for sharing your wisdom and insight with us today. It's been a really wonderful session, and I really appreciate you all joining us. We'll share these resources very soon with you. Best of luck in your advocacy strategies, and we are definitely looking forward to future sessions with you all.
Thank you.